Hello out there and welcome to Public Conscience, the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMORC. I am Adaobi Obiabumo with my colleague Esther Bassi.
Thanks for joining us. Please watch us live on our Facebook stream at official PRIMORC. If it is convenient for you, the spelling of PRIMORC is PRIMORG.
On Public Conscience, we seek to evolve a corruption-free society by drawing government and citizens' attention to corruption reports and issues for prompt democratic actions against them. We also promote integrity by amplifying rare cases of the display of honesty by public and private individuals. We appreciate the MacArthur Foundation for supporting the production of this program.
We will continue to beam the searchlight on the deplorable state of the primary healthcare system in Nigeria, with today's program focusing on Benue State, where reports indicate that a lot of rural dwellers don't access health care, raising a lot of questions about the management and utilization of funds.
According to an investigative report by Premium Times, primary health care centers in some Benue communities are in dire straits with the facility dilapidated, non-existent or substandard, especially in the rural areas of the state where the burden of disease is disproportionately high. The investigation reveals that many communities, pregnant women, and their children travel more than 50 kilometers on motorcycles to access care. The depressing findings were carried out in primary health centers in 4 local government areas of Benue State, including Otupo, Logo, Ohimini, and Vaideka. Only less than 25% of primary healthcare facilities are functioning, according to a 2023 report.
Well, sadly, the poor state of the primary healthcare system in Benue State undermines the Sustainable Development Goals, targets, and the government's commitment to universal health coverage. Today's program will interrogate the management of the primary healthcare system and urge Benue State Governor Hyacinth Alia to urgently intervene. We will also be drawing the attention of the National Primary Healthcare Development Authority, NPHCDA, to the unacceptable state of primary health facility across the nation. For you out there, do you know that primary healthcare system and centers are meant to play a vital role in the health system, but are now facing sabotage? What is the state of the primary healthcare system and center nearest to you? Can you access healthcare service there? What is responsible for the growing number of dilapidated primary health centers in the country? To what extent do you think corruption is affecting the primary healthcare system? How do you get the value of the huge sums of money spent on primary healthcare system and centers around you? Be ready to join us through phone and text messages during this conversation. The WhatsApp phone line to send your message is 0902-265-6167. That is 0902-265-6167. Please indicate your name and your location when sending your message. This number is for messages only.
Please begin to send your messages as soon as possible to 0902-265-6167. We will give out the numbers to call shortly.
If you just joined us, the spotlight is on the deplorable state of primary health care centers in Benue State. Findings by Premium Times say that in many communities of Benue State, pregnant women and their children travel more than 50 kilometers on motorcycles to access health care.
But joining us with details of the investigation is an investigative journalist, Manasa Mbachi. Thank you for joining us.
Thank you very much for having me in the studio today. Thank you.
Okay, we also have in the studio the project associate with Center for Journalism, Innovation and Development, Uchenna Igwe. Thank you for being here.
Thank you. It's good to be here.
We will also be joined via the phone with Dr. Ola Golding, who is the Managing Director of the Comforter and Diagnostic Center. But let's start the conversation first with the investigative journalist. Manasa,
Yes.
could you give us an overview of your report and why you deemed the investigation necessary?
Okay, thank you very much. So my name is Manas Mbachi. I'm an investigative journalist based in Benue State. So the whole idea behind that story basically it's come from the place I was born and brought up, and siblings on the road. Yes, the youngest one is she's 23 years. So sometimes I imagine what would have happened if there was a complication. So when I started journalism, before I started journalism, it was basically the story I hear on radio and television is basically about politicians saying this, politicians saying that, and nobody was talking about communities that are in limbo, communities that are suffering. So my perspective of journalism was based on talking about people who don't have a voice in the society.
Okay, thank you for that background.
Behind covering people that are underserved communities.
Now let's delve into your investigation proper. What did you find out there when you went to the 4 local government area councils?
It was a horrible experience. So let me say that all the 4 local governments I visited, only one primary health care center I met health workers out of all the 4 local governments I visited. So then it was, no one should live in that condition vertically. Those hospitals are in very bad states. There are no basic things like a toilet. You know, in Bandicare, when I visited Bandicare, you know, it was quite difficult for me to locate that particular primary care center because that place is sandwiched between houses. So when I finally located the hospital and they told me that it was hospital, I was really depressed. It was a depressing experience, basically. So the health workers there, none of them was on duty. So the community people told me that they don't even have toilets. So it means that what that means is when these people want to have a convenience or to use themselves, they have to go begging for the neighboring houses so that they will use their toilets. And then if a patient, for instance, visit that particular clinic, and then there is people are skeptical when you visit a hospital and you want to ease yourself, everybody's thinking you are infected. So the women and interview say that it's horrible. People, we don't like going there because when you are sick and you go there and then you want to ease yourself, you have to go beg, and then people say, oh, that bathroom is closed, somebody locked it, and then they have to go inside bushes. And then in Sendia, when I visited Sendia in Logo, it was a very bad experience. I was depressed at some points in my coverage because I met a particular woman who lost her twins. She told me that if you go to that hospital and you are sick, even when you complain, they just write a medicine for you to go and buy. So there are some particular video I took, I videoed in that hospital that if I release them, it actually showed that, oh wow, people in this community are actually suffering.
Okay, Manessa, let me jump in there. I know that there are minimum standards for PHCs, that's the primary healthcare centers. These minimum standards are set up as temporary measures that would culminate into a robust system in future. Does it mean that the primary healthcare centers you visited, none of them met the minimum standard of the PHCs?
None of them even have up to 70% of the minimum standard. None of them.
In terms of personnel, did you meet any medical officer there?
There are no medical officers. I told you that there is only one hospital I met community health workers. There were only 3. And in this hospital, they have only 1 bed at a delivery section. So I asked them that what happened when there are 2, and they don't even have a light. So what happened when there are 2 people, they don't have water? What happened when there are 2 women they are going to put together at the center? They told me that they have to go around the community to borrow a mat.
So what you are saying is that there's no water supply within the premises, and in terms of power supply, that one is also in the negative.
There is no water. There's no water. It closed. And at that time, it was during dry season, so sort of dry season, so there's no water. They travel 17 kilometers to get water.
Let's jump to infrastructure. When you got there, was there anything like pharmacy or dispensing units?
No, none of them. So let me tell you this. So there was a contract. There was actually money that was allocated for building of PSCL. So I traced to find one of them that was actually captured. So when I went there, I met some people who were there waiting for doctors.
Which local government is this?
That was not captured in that story because there's a special story on that where HIV and AIDS patients are buying medicine. So
Okay.
I was not captured. The people, the young people who are HIV and AIDS, they take some medicine to have strong and buying medicine. So I'm going to cover a story on that. I will capture it, but let me tell you, that hospital did not even need in that particular hospital, a health worker was raped, by bandits. So the accommodation for them that hoods that built by this modern kind of building, these thatch houses. So it's a very bad. It's nothing like former health center. They are just, let me call them, it's a place that, looks like some buildings were built in 70s, So it's not near anything, there's no standard anywhere.
All right, Manasseh, let me ask you this. Can you tell us the ways corruption is actually affecting the effective functioning and management of primary health care centers you investigated, the ones you actually went to?
So basically, there's lack of monitoring units. So when I went to Benue, I asked the people who were there that is government aware of this structure that is here? They say yes, the government is aware. They have been coming to do supervision. They have been coming to, at the same time collect a money. When somebody comes to the house, there's a charge that actually belongs to the government. So they only come here to supervise, take all the recording, and then they go. So when I met the chairman of the Benue State Primary Healthcare Board, the woman was so unwilling to talk about something that concerns them at Benue State. Primary Healthcare Center Board, Benue State Primary Healthcare Center is an independent body. So, it shows that there is no single accountability. When I met her, she was angry that I want to ask her about primary healthcare. She was so unwilling to talk about it. Then she said that at the end of that conversation, she said that go and talk to the Commissioner of Health. I don't answer journalists. When even I show her my ID card, she said that everybody can have ID card. I don't want to talk about it.
Okay.
No accountability anywhere.
Thank you so much, Manasseh. Let me ask you this last question before we let you go. After you published the report, has there been any reaction from the government?
There's basically no reaction so far. There's no reaction so far from the government.
All right. Thank you so much, Manasseh Mbachi, an investigative journalist who joined us via the phone from Benue. Thank you for your insight and continue the good work.
Thank you for having me. I appreciate it.
Okay, we still have in the studio the project associate, Uchenna Igwe from Center for Journalism, Innovation and Development. How would you react to all of it?
You see, it shows how bad primary healthcare centers, the bad conditions of primary healthcare centers across the country, not just in Benue State. It's not peculiar to Benue State. It's so bad, really. It's these primary healthcare centers are supposed to be like the first point of call for citizens in these areas, but you find out that they're not functional, and just a pity. So it brings you to think about the sufferings that these people go through in these communities. Where most of them live under the poverty line. Not affording $1 a day. So it's healthcare is expensive. You know, even for people in urban areas. So it now brings you. So a lot of people even struggle to cater to their medical needs in urban areas. So it now brings you to think about what people in those rural communities are going through with lack of facilities, lack of medical supplies, poor infrastructure, shortage of staff. It's a lot.
Whose primary responsibility is it to cater to ensure that the primary health care centers are functional?
So in Nigeria, it's the responsibility of the local government in Nigeria, ideally. But I mean, we know what's been going on in Nigeria with the whole issue with local government autonomy and all of that. So it's difficult for us to expect local government areas to be able to properly fund and cater to.
So who should we hold responsible?
I think everybody, it's a collective problem.
When you say everybody, am
Yeah,
I
at all
responsible?
no, no, at all level, government at all levels. The state governments have a lot, to answer for. The local governments, I would say are quite helpless, also have their roles to play.
Okay. Uchenna, please, I will hold you up there. Let's get to Dr. Ola Golding, who is the Managing Director of the Comforter and Diagnostic Center, Abuja. Thank you for joining us, Dr. Ola.
Yeah, good morning.
I'm pretty sure you've gone through the report. So how would you react to it? Are you bothered? Or is it something that you're familiar with already?
Yeah, that is the primary health care system in Nigeria, generally. You see, it will take a whole lot of the people's efforts to be able to change the way the primary health care is being run generally in this country. I've been at the primary health care level for several years now. And I see a whole lot of gaps in the way the primary health care sector is being taken by both the local authorities, the medium authority, and the highest authority. Until such a time when the people, the healthcare workers, are being encouraged to stay near where people are, it will be a waste of money to keep building different types of structures around the country in the name of primary health care center. Nobody will want to go into the rural areas where they will not be able to have minimum quality of life. The second thing is the private healthcare sectors, which should be encouraged to have their branches in the rural areas. Even if it means that visit to this, primary branches in the rural areas will be maybe twice a week, 3 times a week, as the case may be.
But what would be the incentive for the private owners of hospitals to have their centers at the rural areas?
I didn't hear that.
I said, what would be the incentive? Because you suggested that private owners should be encouraged to have their centers in the rural areas. So what's the incentive for the private owner who is there to make money?
Okay, you're talking about the incentives that can make them go there, right?
Yes.
One of the incentives is to be able to contribute to the health care of those people in those areas. The thing is, there's a little bit of survey of what is the population of the people in certain zones in the rural areas. And then be able to see how you can do what you call the doctor patient ratio of probably one doctor to probably 1,000 people. Let's take it just like that.
One doctor to 1,000 patients.
One or two private healthcare practitioners may want to go there with such an incentive that comes from either the local government authority or even the state government or the authority. Take into consideration that the family of the local authority may not be able to afford what it can, take care of the whole of their local area. But to me, the only way to do that is if the government cannot, then the NGO can actually encourage to give
Dr.
This
Ola,
is the only way that it can work.
okay, I understand the fact that you want NGOs to allocate funds or their intervention should be geared towards looking at the health outcome of those in the rural area. What of the local government whose responsibility it is to ensure that these primary healthcare centers are functional? And remind you that their money is allocated for such primary healthcares in the budget.
Yeah? But these things are not utilized for what they are being represented for.
So shouldn't we hold the local government accountable or the state government?
They should hold the local government because it is now that there is a law that is now making it direct, payment to the local government. Now it is time to hold them accountable. Otherwise, before now, it has always been the state government that have been, covering up the inactivity of the local government areas. Now that they are going to be taking them directly, yes, it is now time to actually make them to account for whatever they have been given for such budgeting activity. Then the government should just be the people that will be monitoring what is going on in different local governments around, their states. The federal government should have only what you call an overview of whatever is going on. And each one should be reported back to either the state ministry of health or federal ministry of health or even the NGOs that bothered about the health of the people. Because if we don't do that, if the citizens don't cry out, if the citizens don't, ask for what they deserve, nobody is going to give it to them on platter of gold. That's just the truth.
All right, Dr. Ola. Well, it appears that the majority of primary healthcare centers within or in the country are in poor states, right? So what does this spell for us? What's the implication, on citizens?
Yeah, of course, we have discussed about the fact that citizens are the ones that are suffering for all these oversight and whatever you can call it. But you see, the poor people who live in the villages, the only thing that we can do is to encourage whatever they are doing in those villages. If they are farmers, if they are fishers, if they are traders, each of these things that they have to do will be encouraged by other people that are non-governmental. Because the time you push any incentive to this group of activists or itinerary workers, they will always get needs on the road. But if the NGOs can come in to be able to make sure that they get what they need, then they can monitor how they utilize it. That is the only way we can help them be able to do the best for themselves.
And my other guest in the studio does not quite agree with your submission of NGOs intervention.
No.
So basically, I understand what he's saying, but we also need to be aware that the NGOs have done a lot for our primary healthcare centers. When you go to these places, you find that most of the drugs were donated by NGOs, Gavi, EQs, USAID, so they're already doing a lot. So I don't see any reason why we would try to alienate the government from their primary responsibility. This is your responsibility. So why, if the NGOs can support, corporate social responsibility of of sorts, but not to make it their primary responsibility. These are non-profits.
Okay.
And earlier he talked about having private clinics or thereabout come to local government areas. People are in this to make money. It's not social service. The government provides social services, not private individuals who are, undergoing private practice to get out to their family. So if the government who has this as primary responsibility cannot monitor, cannot fund, cannot provide for or cater to these primary healthcare centers, how well do you think the private sector would do?
Dr. Ola, did you hear my other guest?
Yes, I'm hearing.
Okay, so he does not agree with your earlier submission.
Yes, I think what is said is that he said we should continue to say the government must do what it needs to do because it's their primary responsibility, right? Everybody knows that. But in a situation where you have the government that are taking themselves the way they are taking themselves now, as if it doesn't concern them, then if we as the people cannot come out to look for alternative solutions, then it will continue to be the same way that this all
All right, Doctor Allah, point made.
Once they are able to do that, it will be better. That is just what I would say.
Okay, Dr. Ola, but can you tell us to what extent is corruption undermining efforts to improve the primary health care system in Nigeria, seeing that we've spent huge sum of money in this sector?
You see, corruption pervades every strata of life in this country. And that is the problem. Because we as citizens, we also aid and abet in corruption. Now, if it's government is for the people, right?
Yes.
Of course.
And the same people that are in that government, you cannot say that because the governor is in the central place, then the local government chairman has no responsibility to you. Your local councillor has no responsibility to you. Everything that happens around you is discussed about the governor, your president, and so on. What I believe is this. Now that local government has been given the direct allocation that we said, and if they now start getting it, it's about time that people start rising up. Not only people in the villages, people from the town who come from those villages should be the vanguard for those people in the villages. Because people in the villages may not know their rights. They may not know what to do in order to get to the source of what they are lacking. So the people from the cities who know what, who come from those villages, they should be the ones to stand up to ask the question they should be asking the local government, chairperson, councillor, or whatever they call themselves. Then the thing will now work better. So I've never excused the government from what they are supposed to do. I'm only saying to say that if the government cannot afford to place this thing where it should stay, then private practitioners can be, encouraged to come over there. That is what I'm saying.
All right, Dr. Ola, because of our time, let's have you react to this last question. What would be your advice to the state government on addressing the plight of rural dwellers affected by poor state of primary health centers?
I would just say that the state government should know that health is wealth. Without health, every other thing they budget for is nothing. You cannot ask somebody that is sick to go and farm. You cannot ask somebody that is sick to go and do any other thing. If they take health as their primary responsibility, then they should look for how each and every member of their state should be helped and have the type of health care they need. That is my, point. That's my advice.
All right, thank you so much, Dr. Ola Golding, Managing Director of the Comforter and Diagnostic Center, Abuja. Thank you for your insight this morning.
You're welcome. Thank you so much.
Okay, if you're still tuned in or you just joined us, this is still Public Conscience, a production of Primorg, and we're x-raying the poor state of primary health centers in Benue State. And I know that if you look around you, maybe the primary health center close to you may just be a replica of what we saw or what the investigative journalist reported of what is obtainable in Benue State. We heard the voice of Dr. Ola, requesting that private practitioners, though he did not say that the government should be isolated from their responsibilities, but that private practitioners and NGOs should also assist in ensuring that the health outcomes of those in the rural areas are improved. Do you agree?
Oh, I mean, I don't agree. It's a primary responsibility of the government at all levels. Healthcare, basic medical services. We cannot allow the government to, just
allocate funds and nothing is done.
Because it's something that you think about and you can't just understand why it is happening. A lot of money is allocated to healthcare services every year, but we don't see results. So I actually think that we have a policy craze in Nigeria, in this part of the world, where we are just interested in making policies
and not implementation.
Just documents here and there. We have the National Health Act. We have the Health Insurance Act. How are we implementing these things? How have we implemented them? You look at PSCs across the country, all bad.
Can you say all of them?
The health minister the other time said 10% of all PSCs are functional.
So we cannot say that all of them.
10%.
So does
Okay,
that mean
let's get the
okay.
person listening at the other end of the dial to join the conversation.
Okay, for you out there, please follow us on our social media platforms at Official Primark. Remember that we are streaming live on Facebook at Official Primark.
And remember that this program is interactive. The WhatsApp phone line to send your message to is 0902 265 6167. That is 0902 265 6167. Would like you to contribute to the conversation. I know that I'm pretty positive that there's a primary healthcare center close to you. How functional is it in terms of the personnel, infrastructure, service delivery? Would like you to share your experience with us. We want to get updates. And do you trust the system such that they can cater to your health need? Or when you are down with one form of sickness, you run to your friends and relatives on social media requesting for money because you want to visit private hospitals. We want to get your take.
Are we saying that the primary healthcare centers are perpetually set up to fail?
You just said it. You just said it. Because, I mean, for the health minister to come out to certify that only 10% of this PSCs are functional. Now, when he says functional, it means probably they open on some days or people can access these places. You get that is just being functional. If we now look at how many of these PSCs meet the minimum standard, I don't think we probably would end up at 0.5% or even less. So it's a big problem. It's a big problem. In 2012, we had President Buhari, who flagged off the revitalization drive for PSS in 2012, flagging off with a model PSS at Kuchigo here in Abuja. How many of these PSS? They said they were going to revitalize 10,000 PSS. How many were actually revitalized?
Did we get one?
A few of them actually, in fairness to them, a few of them were actually worked on. But how many? Did we meet the 10,000, the target of 10,000 PSS? So these are the questions we need to ask ourselves. If you say only 10%, it's shameful actually. It's shameful to say only 10% of the primary healthcare centers in your country
and
are
supposed
functional.
To have one primary healthcare center
in each ward. So it's shameful, really. And you know, all of this has its impact, adverse impact. Now, let's look at it this way: how many people visit the PHCs in their areas? I mean, the PHC is supposed to be like the primary. It's called primary for a reason. It should be where you go to for your primary health needs to be met primarily, not the hospitals. It is when probably it's a severe case that you probably go to by referral, and if it's now too much, then they refer you to the tertiary, which is the teaching hospitals and the FMCs. So, but you find out that when you go to government hospitals, you find a lot of people there, and what this is doing is overburdening the secondary healthcare sector.
So now that we've talked extensively about these primary healthcare centers and their state, is it a question of budget? How much was budgeted for these centers, or someone somewhere is living fat off the funds for improving the state of these primary healthcare centers?
It is all of the above. So in 2001, we invited our heads of states of African countries to Abuja. We hosted them, and at the end of that conference, we committed to having a 15% annual budget allocation for health. It was called the Abuja Commitment. So you see how complacent the whole thing is. When you look at the Abuja, it has your country's capital as the title, Abuja Declaration, which says 15%
Budget.
should be allocated to healthcare in each of these countries. You hosted this. Have we ever met this target?
Question to
No.
be answered.
We haven't. So it tells you that we're just interested in jamboree, invite people, sit, sign papers, you know, allocate money to committees to draft these papers, pay consultants and whatever, sitting allowances, public hearings, and we have these policies. Then we develop cold feet when it comes to implementing these policies.
So, do you think this the ruling from the Supreme Court in terms of granting the local government autonomy, financial autonomy, do you think it would in any way help to improve the state of the primary healthcare center?
We can only hope. Some time ago, Algon, which is the Association of Local Governments of Nigeria, took the federal government to court for trying to grant them that autonomy. So it shows you that there's a lot of, foul play behind the scenes, because we're trying to grant you autonomy to run your affairs, and you're taking us to court. So we can only hope to see what this.
But while we are hoping, children are dying, pregnant women are dying, our elderly, they are not being taken care of properly, and a whole lot of issues coming up there, things that would have been handled ordinarily at that level. And you know that some of these primary healthcare centers, they are not easily accessible. Some would have to travel as far as 10, 15, 30 kilometers to get to a particular primary healthcare center because we don't have them in all the wards. While we are hoping, people are dying. Should we continue to hope?
What do we do? This is basically
the
where
second guest said we citizens in these urban centers, they need to assist those in the rural centers to cry out. They need to educate those. We need to mobilize and hold government accountable.
I agree. And that's the bulk of the work we do at the CGID. Citizens education, civic education, citizens enlightenment, and then engagement for such advocacy. And since 2014, where we launched, we have championed this cause in communities across Nigeria. So it's not just for us to to keep doing. Everybody has to get involved. Citizens, you have your family in the villages, in the rural areas. You have to speak up. You have to get involved. If you see something, you say something. So it's not like because you're not affected, you don't stay in these communities. So you feel like things are things are going on well. It's saddening, really, because we don't have farms in urban areas. We don't have enough farms in the urban area. We expect our food, agricultural produce from these communities. Now, if people are sick, not healthy, how do you expect them to go to the farms?
And there's a nexus between health and well-being with productivity.
Exactly.
Right, so do you think that the responsibilities of the primary healthcare center should continue to rest, on the shoulders of local governments?
Well, with the new
Even with the autonomy.
directive, we can only wait to see how that plays out, because this is where we should channel our efforts at holding leaders at the local government area accountable for every penny that has been allocated to them. And it would just you to know that a lot of money has been allocated from the physician account to local governments all along. But obviously because of the issues and having state governments hold them to ransom, I would say, they have not been able to access directly access this allocations. Probably at the end of the month, the governor sent 100 million naira to this local government because probably he's cool in good terms with the chairman, and then this other one that he doesn't think he's close loyalist. He probably sends 50 million or nothing at all, or just enough to pay salaries. So but now with the direct allocations coming into the accounts, we wait to see, and not just looking. We'll hold them accountable because this is time for citizens to at local, and it's very interesting that this is happening now because now this is the time for local governments to show us their budgets because now you have to tell us what you're doing with these allocations. It's no longer uh, the box is no longer dropping on the table of the state governments now. The local governments now have to show us their budgets and show us what they are doing with these allocations. And I think it's interesting now because it's no longer the work of just NGOs. It is now within your reach. Your councillors, your local government chairman, you're seeing them every day, so you ask them these questions.
Okay, that would be your advice on the part of the citizens?
Yes, yes.
So then to the Benue state government and the president, what would be your last word for them?
I think we should focus our strength on implementation. We have the Health Insurance Act, the National Health Act, all these policies. How have we implemented them? The government is supposed to be a continuum. If we have this roadmap for health, how are we following up to ensure that they are met? Because I don't think that these policies are just designed for just for that sake, for the sake of just designing them. They are designed to meet particular needs. You understand? So if a government before you has drafted this policy, signed this policy, what you should do is ensure you could review, but ensure that these things are actually implemented. So we have allocations for healthcare, primary healthcare centers in local governments, in different local governments in the state budgets of different states. But at the end of the day, we don't see any results. Yeah, results. Because nobody is asking questions, nobody is fully where these allocations released, who are the contractors, why were these contracts not executed? So these are questions we need to ask ourselves.
All right, thank you so much, Uchenna. You have heard my guests, Uchenna Igwe and Dr. Ola Golding. We should all get involved. We should ask questions. And for the governors, those in authority, if you want a productive workforce, we need to take care of their health needs. Esther, we really must go.
Please visit our news website, primognews.org. That is primognews.org for all the details of our reports and interviews. Visit our website, www.primog.org, to get all the information about Primog.
And you can watch our videos on Primog TV or our YouTube channel. Please subscribe to get reminders when we have a new post. Sincerely appreciate our guest, investigative journalist Manasa Mbachi, who joined us via the phone from Benue State, and Uchenna Igwe, who is the Project Associate Center for Journalism, Innovation and Development, CGID. Thank you for being here.
Thank you so much.
Our sincere appreciation also goes out to Dr. Ola Golding, who joined us via the phone also, Managing Director of the Comforter Diagnostic Center. And Public Conscience has the support of the John D. and Catherine T. MacArthur Foundation, committed to building a more just, verdant and peaceful world. Get more information about the foundation on its website, macfound.org.
Join us again here next week for another episode of Public Conscience. And remember to follow us on Facebook, X, formerly known as Twitter, @OfficialPrimeWalk. I am Esther Lassie.
Remember that birth registration and certificates are free if your child is under 18. Help stop the corruption in birth registration and do not pay for birth certificates. Also remember that you can give us information or hint about corrupt acts through our phone at 0902 265 6167 or info@primewalk.org. I am Adaobi Obiabumo. Thank you for listening.